with me while I add the third little browser source here. Hey all, welcome to the Veteran Gaming Australia stream. Today we're here with Jonathan and Andre from Champion Health. They're doing a lot of great work in the veteran scene in relation to the physical and the health recovery of veterans. We will be going through, obviously, some great questions that have been asked previously by veterans to Champion Health also. But while we're live also, if you do have any questions, make sure you pop it in that little chat. So we can obviously get those correct answers and get you the right information. What I'll do is I'll pass over to Jonathan just for a quick introduction spiel about his experiences and what Champion Health is about, and then he'll flick over to Andre and we'll rip into question time. So over to you, John.
Thanks, mate. So my name's Jonathan Reeves. I'm the exercise physiologist team leader at Champion Health. My main area of specialty is low back disorders and how to train around low back pain and enhance your athletic performance overall. So I've done a bit of work and done a few courses with Dr. Stuart McGill, the world's leading spinal biomechanist, and also some coaching under Brian Carroll as well for strength conditioning. I've got obviously Andre here, the clinical lead for Champion Health. But Champion Health essentially is Australia's largest membership-based allied health company. So our long-term plan is to integrate allied health with specialists and GPs. So effectively being the one-stop shop for all your holistic health needs and effectively taking out private health. So we are basically going to be the next private health without paying for private health. But yeah, that's what we're about and what I'm about. I'll pass over to Andre if he wants to give a little spiel about himself.
Yeah, thanks guys. So my name is Andre. I'm originally born and bred in Norway. Came over to Australia in 2015 and ended up in Townsville, which Jonathan knows is the best place in the world, obviously. So good place to study. So I kind of came into the health field a little bit randomly, but very quickly studying health, realized that there are a lot of issues with the current healthcare system, and I wanted to be a part of changing that, and ended up in Champion Health about 3 years ago now. And the mission of Champion Health, like Jonathan said, is to kind of reinvent healthcare in the private sector, because it's now it's a big lack of transparent communication, teamwork in a multidisciplinary team, and the current pay-for-service system is just not good enough, to be honest. So I am a nerd of heart. I love reading, I love studying. In my role as clinical lead, also as a diagnostic specialist clinician, so I look after anybody who requires a diagnosis, proper treatment planning, second opinions for conditions and similar. So really enjoy that role. So yeah.
That's awesome.
Yes.
Yeah, no, thank you for that, boys. Definitely appreciate that. We have flicked over some questions that we have had previously from our Veteran Gaming Australian members. Quite in-depth questions and stuff like that, so we will try and let them answer it as best as they can effectively. As I said, as we're going along, ask those questions effectively though, and let these guys know your kind of physio needs or any health needs, because they'll have a basic understanding of the health side, but the physio side 100%. You know what I mean? So just rocking into the actual questions that some of our members have asked and stuff like that. So we'll rock on with the first one. What one of the veterans asked was, so they were asking about certain exercises, and what they mentioned was, is there any exercises personally that you would recommend, or how could they minimize certain wrist fatigue when they're either using the mouse or throughout gaming and stuff like that?
So very commonly with injuries that has to do with obviously operating a mouse is injuries on the side of the little finger, so this part here of the joint. This is a very special part of the hand because it has a complex ligament structure called the TFCC, which some of you might have heard of before. And the TFCC effectively is a weight-bearing joint. So the purpose of it is to transfer weight through the arm. So when you, for example, let's take handstand as an example. When you push through like that, all the weight comes and distributes through the bones here. So it's a weight-bearing joint. It actually has a structure in there that's similar to the meniscus in the knee. It's not innervated by any nerves, that structure, but the structures around it can flare up as a reaction to damage in that joint. So it's actually quite a complex injury, these are typical wrist injuries. And contrary to common belief, exercise is not always the key for this. And this is where things get a bit interesting. If there's pain on the outer part here, the first thing we need to determine is it one of the ligaments that are getting fatigued and tired from overuse? And very often these type of movements, like you'll do with the mouse, causes those overuse injuries. And a very easy way to test that is actually with just some thin tape.
Okay, yeah.
So what you do, these type of tape here, if you guys are ever in the clinic, we can do this test for you quite easily. But time yourself, see how long you can sit in game for before you start getting the symptoms. The tape goes just around the wrist. Just you have a little bone of protrusion on the top of the hand here. You'll feel a little bump on the side of the little finger. Go just past that bump, wrap the tape around, and compress it hard. So the tape effectively should be like a compression band.
Okay.
Right? It should be a bit firm. So one strip just in front of that bone here, and one strip just after the bone. Do another one here. Like that. Here we go. So you kind of get this type of dual band structure.
Okay.
Now, if that helps and that takes away the pain and you can game for longer, then we know that it's a TFCC injury and we know that exercise isn't the key for weight bearing. But actually something as simple as this little device here called a wrist widget can make all the difference in the world. So they cost about 50, 60 bucks.
Interesting.
If that works, with the taping strategy, these guys here will save you a lot of pain.
Okay, that's very interesting. Is that usually related to nerve pain and stuff like that, for example?
No, it's not related to nerve pain at all. Nerve pain is a little bit of a different beast, and very often nerve pain will come as a result of a compression of a nerve during a certain interface.
Okay.
Somebody's got kids in the background.
Yeah, sorry, you will have kids in the background being noisy and stuff like that, so...
Yeah, excellent.
Joys the family laugh at times.
Oh, it's good fun, isn't it?
Yeah.
Nerve pain can come from a couple of different areas in that part of the wrist. So nerve pain can come out from this little canal on the side here.
Yep.
And if you have a bit of pain on the side here that radiates into these two fingers, so your little finger and your ring finger, with a little bit of kind of pins and needle sensation, can sometimes feel like the fingers get heavy and they get hard to use, that can be an indication of nerve pain, and that you need to check that out pretty thoroughly actually. So if you get those type of symptoms, you should seek a professional to check that out, because we have special tests that we do to check if the sensation is intact, if the motor output is intact, and we can deal with that quite easily.
Okay.
The other area is if you lean on this part here of your hand quite a bit when you game, that nerve goes straight out down here and in through and into the fingers as well. So leaning on this part of the hand can cause a nerve injury, but you'll normally feel things like pins and needles and numbness accompanied with pain. It won't be a pure pain presentation. So
Yeah, no, that's fair enough. Have you found it there to be a lot more effectively of, obviously, as we're ripping into more technologies and constant computer use and stuff like that, are you finding these injuries popping up more and more in relation to the wrist and stuff like that?
yeah, TFCC injuries in particular are quite common.
Okay.
So, and these guys say they work wonders, like they make a big difference, but you need to do the little test first. So you don't, like if it is TFCC, you want to just do that cheap compression test first. But that seems to be the best way to treat them, because it is a weight bearing joint. So any exercise wouldn't kind of fix weight bearing issues, right? That wouldn't take away the need for that joint to be a way to take forces like this. So exercise won't necessarily make a big difference in that case.
Okay, no, that's excellent. Well, I hope the veteran that's asked that question, that's definitely a good answer. That I can see that they could actually test that out and get a remedy for that, I believe. So, yeah.
If that doesn't work, there's a couple of other differential diagnoses, but they generally require an ultrasound to check it out too.
Yeah.
So if that doesn't work, just send me an email, and I'm sure you can link up my email to the guys, and I can help with figuring that out. So.
100%. No, that's excellent. So one of the other questions that one of the veterans asked, so obviously we get quite a lot that veterans they'll always ask about certain gaming chairs and other things like that, orthopedic chairs and stuff like that, because you'll be sitting down over longer sessions and things like that, but some of the times they won't have, either they're not in the right financial position or They just haven't chosen that right chair at times per se. So some of the complaints that they've had, say, were their lower back hurts sometimes when they're gaming, but they put it down to usually their posture and stuff like that. They've recommended for how they can kind of fix that posture over over shorter sessions, but also over the longer sessions that they might be having a video game or something that they're playing.
Yep. Posture is one of these weird and wonderful things now where there's a lot of debate on does posture impact pain or does it have any correlation with pain? And what we're kind of finding is that there's not one correct posture. Like everybody has a different posture, and just because someone tells you that your posture looks like shit doesn't mean that it is shit, right? So that's really important. The biggest factors that we see is actually sustaining the same posture for a long period of time, so keeping one position for quite a long time. So the kind of simple, very, very simple answer is we need to change around our positioning, and we need to experiment a little bit with being a bit more forward length, being a bit more backward length, and finding that time to change their position posture before the pain comes on. That's the best way to kind of start to address this. The first thing I'll say is a lot of gamers over time, as they play, and I do this myself when Jonathan beats me in Age of Empires quite often, is you tend to end up more and more over here, forward length. And we tend to kind of sit in those forward length positions quite a bit. So a simple thing as having a chair that doesn't have an armrest and then popping that chair a bit closer to the screen actually just changes the posture automatically because you can't lean forward. You'll hit the screen. That's a simple way that you can change it quickly. You can have little pillows behind your back, but also pop a pillow or something a little bit thicker under your bum because that changes the angle of the hip.
Okay.
When you change the angle of the hip, that'll change your posture more and it's easier to maintain an upright posture. So kind of going between kind of having a pillow on your bum, going a bit closer to the screen, then going back to your normal positions and varying that posture is the best way to go about it.
Yeah.
The other part is any opportunity where there is a break in the game or you have a minute in the game, just to kind of stand up and straighten out makes a massive difference.
Yeah.
If I can just add to that as well, 100% agree with what Andre's saying. There's a good commercial product. I use it all the time at work when I'm at the desk. It's called the Lum Air, LUM, and then AIR after that.
Okay.
And essentially, what it is, it's a back support. So if you don't want to go out and spend all the money on this, a new ergonomic chair or whatever, or you can get these Lum Airs that you place in the low of your back. And it's kind of like a blood pressure cuff, so you can pump it up, and then that adjusts how much extension or flexion is in your back. And then so you might pump it up a little bit and give yourself a bit more upright posture. And then when that starts to become painful, you can just let a little bit of the air out, and then that reduces the amount of arch you have, and then you sit a little bit more flexed. So it builds on for what Andre's saying. It's a really cost-effective way to make sitting an active task instead of a static task.
Yeah, because I guess you're right. Like those static tasks are obviously they're the bits that are causing, say, these other bits of pain and stuff like that. Because done a little bit of research in relation to, say, the esports side, and obviously you're relaxed type gaming, right? So you're relaxed type gaming. Usually you're on a couch, you're sitting down, you might just be slumped backed, kind of thing. Bit more comfortable. Where esports, you're a bit more kind of hunched over the computer, concentration. But you're right. Like you do need to implement those right things.
I just sent you a link in the video room here for you, Sam, so you can kind of share with your group. I wasn't allowed to share that on Twitch because I don't have an account there.
That's fine.
But that's for the Lum Air that Jonathan recommended because I agree with him. That's an easy way. You can pump it up and you can take it away.
Yep.
Other little things that you can do when you're concentrating is simply cross one leg over. I don't know if you guys can see me, but one of my legs is crossed.
Yep.
And that changes the load a little bit. That can be a simple solution to change things up to.
Okay.
If you need to sit forward. So it's just changing your legs up, using the other leg, coming here, changing those positions. It just changes the load. It changes where you load the back and it changes the position of the back. So the key here is movement, right? Anybody who sits in one position for quite a long time will likely feel some discomfort.
That's definitely great advice. I strongly recommend, obviously, I strongly agree. Coming from the esports scene also, quite often we do just movements and stuff like that, obviously in between your sessions and stuff like that. And each session could only be, say, 15 to 20 minutes each one. but it keeps you on top of your game effectively and keeps that pain away. So 100% right there.
Just to reply to Aaron here, stand-up desk can actually be quite a good way to to change that load on the back. So you have that ability to go from sitting to standing in various positions. I wouldn't recommend standing upright for, let's say, many hours if you play the time, but going from standing to sitting is a great way to change the load. So excellent solution.
Yeah, no, that's great. And they're becoming a lot more cheaper and easily accessible now, the stand-up desks, so compared to when they first came out. Now pretty much anyone can have them rather than paying an exorbitant price of, close to $800 and stuff like that. They've come right down now. So
you can get the cheaper ones for about $100. Officeworks sells them for about $2 to $20, so they're quite a cheap solution.
Yep.
If you have with DVA, you can potentially get it through DVA as well as a service there. So for people who have gold cards and similar, there might be a possibility to get it funded through DVA.
Yeah,
so.
100%. No, excellent. And so one of our members, I know this one previously. So they've had cancer and stuff like that in the past. They've had extensive nerve pain that's come on from that cancer and stuff like that. It's put them off. That pain factor effectively has put them off trying to get other further help for that nerve pain and movements and other things like that. Because I guess once everyone sees pain, they don't kind of want to. They think it's going to aggravate or other things like that. I'm just wondering, how do you work around, say, if a person's suffering with nerve pain and stuff like that?
Nerve pain, in particular cancer-related nerve pain, is a bit of a different beast because it's not something you can't rub a muscle and get rid of nerve pain. That doesn't work, right? You can't needle it and get rid of nerve pain. Those things are completely ineffective for nerve pain. Nerve pain, first up, the first thing I say is you need proper medical management for nerve pain, and you should be seeing a neurologist, and you should be having you on some nerve modulating medication. The biggest thing is we got to figure out what is your threshold. How much can we move you? How much can we exercise you? And how much can we get you kind of going before you start to get a pain? And we need to find that level of kind of pain threshold for you. But then one thing that nerves really like and they really respond well to over time is cardiovascular exercise. So that can be as simple as being on a bike and going hard intensive with the bike. You can be running in a pool if you don't like normal running. So you can submerge yourself down to the neck, for example, and you can run in the pool, and that's super heavy. If you have something holding you back, it's quite good. The biggest thing is we do an assessment and we figure out what triggers the nerve pain, where's the distribution of the nerve pain. Do we have any techniques that offload the nerve pain? So are there any mechanical features of the nerve pain? Once we've figured out those factors, we can then make a pacing schedule. So we effectively make a plan for how much activity we do, the intensity of the activities, and we slowly progress that over time in conjunction with medical management. But if somebody comes in and starts to rub you down and do a lot of massage and stuff for that nerve pain, it's likely just going to clear it up, and I probably wouldn't recommend that long term.
Yeah, no, that's fair enough. And I mean, especially when it comes to nerve pain, I know quite a lot from other veterans and stuff like that. It usually comes on impact and other things like that too, kind of flares it up usually. So you definitely recommend, say, these swim activities and other activities that will kind of reduce that impact in a way?
Yeah, so if it is an impact-based nerve pain, which a lot of them are, I would probably do non-impact activities like your submerged running, like your swimming, like your cycling. That can be a better tolerated activity for you. But there needs to be an activity that gets the heart pumping and it gets into that high-intensity exercise zone. Yeah. That has a very strong anti-inflammatory effect. The other part about nerve pain is pain itself is really fascinating because the immune system actually has a very high control effect on pain. So if you've ever noticed that you're more sore in the morning, like every time you get sick, you're always sicker in the morning, your joints ache more in the morning, your back pain is worse in the morning, that's because of the circadian rhythm, and that impacts the immune system. So the immune system works really at high levels at night, right? That's when your body does all the healing, and that's when it fights off bacteria, which means that in the morning you have more, a stronger immune response, which then triggers pain. So we need to work with kind of reducing the immune response there as well, and that can be things like good quality food, good quality sleep, combination with exercise, combination with those healthy lifestyle factors, mindfulness and meditation, and those type of therapies can be quite effective too.
Okay.
The other thing I say to people with nerve pain is we need a flare-up management plan, and we need to do that in conjunction with the medical team. So let's say that you do an activity that flares your pain up significantly. We don't want you to be laying in bed for 2 weeks recovering, because it's a waste of time. It's a waste of time. Yeah, it's very counterproductive. So having a management plan that consists of appropriate medications for short-term use, that can be like a very short-term use of tramadol or something similar, which the medical team helps with. A short-term use of something like your stress relief management, like some people like sensory deprivation tanks, some people like meditation, some people like swimming, like the different things that people respond well to. And then optimizing things like your recovery massages and stuff can be quite effective in just getting that flare-up settled quicker. So developing a flare-up management plan with your physio and your doctor can be quite effective in kind of managing that nerve pain. But in essence, good quality sleep, good quality food, healthy aerobic exercise, figuring out what triggers it and making a pacing plan. Well, that is how I would treat that in clinic.
Just to add on to that as well, I feel in the allied health space, hands-on therapies have copped a bit of a slagging recently. But to build on what Andre said there with the pain management plan, I've seen countless times where they've had their physiotherapy session, they had hands-on treatment, and that's actually given them a pain-free window to come on down to the EPs and actually get some pain-free exercise in that they would have never have actually had if they had not have had the hands-on treatment. So yeah, highly rate it. If you go to a physio somewhere and they say it doesn't work, I beg to differ. Every tool has its place, and I rate it.
I would agree with that. In those instances too, we wouldn't go in and trigger point you. We would do like lighter massage and we kind of relax the nervous system. With those type of flares, you don't want an elbow in your back, but you want something lighter, something that kind of reduces muscle spasm and stress a bit more.
No, that's fair enough. And so we just had a quick one in from Aaron. So he's asking about DVA covering sensory deprivation tanks. I don't know if you know much about the sensory deprivation tanks yourselves. I don't have a...
Yes.
I've heard about some veterans in the networks trying to get them previously also covered through DVA on that system. But what's your thoughts in relation to, say, the sensory deprivation tank first up? And have you had any exposure to DVA covering this in the past at all?
DVA doesn't cover sensory deprivation tank. Just put that out there. Yeah, unfortunately. I love them. I use them a fair bit myself. Like, I love sensory deprivation. So I'm a big advocate. But Jonathan looked like he was about to say something.
I was just going to say that as well. I don't think DVA would cover that. But yeah, I rate it as well. It's like meditation on steroids. So yeah.
Is it a costing factor that you believe? Why? Is it purely off cost factors?
I think it'd probably come under more like alternative therapies. And you run into that issue as well with private health funding. So some private health funds don't cover or cover limited amounts even of exercise physiology, where they deem it as an alternative therapy, which is interesting. But anyway, so it's probably something along those lines.
Let's get the bodies moving again. We'll put that as...
How horrible, right?
It can happen from time to time, unfortunately. You hear your little horror stories here and there. But hopefully in time that does change, I guess, with more research possibly coming out in relation to the background that too. Because I know usually they'll rock on the systems of, there needs to be a lot of research backed behind it effectively.
It's quite fascinating. There needs to be a lot of research behind a lot of things, except for the things that they like. It's what I find with DVA sometimes. So, unfortunately, the problem is also that sensory deprivation at this stage here is not an FDA-approved therapy, which makes it difficult. While FDA is the wrong system, but it's not a regulated type of intervention, right? So it's not a part of a regulated allied health or medical team, and this is where DVA won't pay for those services, as it's not a regulated therapy per se.
Okay.
That's the difference between your normal massage and your remedial massage, where normal massage isn't regulated, but remedial massage is regulated. So high caps is a possibility with those guys. So private health funds them.
That makes sense. As Aaron said there, new technology, no clinical studies. That's 100% correct, I believe, in relation to some of the other systems also. That's excellent in relation to the nerve pain and cancer. I hope they've got the right answer. That's seems spot on to me. He's got the right approach around that, which is great. Because I too have nerve pain and stuff like that, you know what I mean? And I had the management around that. You don't want anyone kind of prodding there too hard to get from the get go. You don't want to be that off putting effectively, you know what I mean? So he's got the right approach on that.
Just to come back to that, Sam. So your nerve pain's more related to your neck, isn't it?
It's purely neck related. So
Yeah. So I just think we should caveat that nerve pain from cancer and
it's different.
musculoskeletal nerve pain very different
Yeah.
and managed very differently as well.
Yeah. No, 100%. Like, I wouldn't expect cancer to be very similar in relation to nerve pain. It'd probably be on a complete different spectrum, compared to, say, muscular or, I guess, a bone type injury in a way. But, so one of the other questions that we had off one of our veterans, though, so they were talking about if they were looking at going to physio with an injury, what would they expect in going on their very first visit effectively?
So this is a very interesting one too, because one of my big passions is to upskill physios in Australia. That's a big part of it, and we see a very large discrepancy between the practice of physiotherapy in Australia at the moment, where you have a very good level on one end, and on the other end you have a questionable level, which is like with any other professionals, right? So there is a difference between what you should expect and what you in some cases can expect. But what you should expect going into physio is you should expect a comprehensive history taking. So they actually listen to your story, listen to what you had to say, take the time to let you speak, help you to reflect over what kind of what's been going on, help you to kind of dig deep into the story to understand you.
Yep.
Not just understand what is your pain, but also understand why is this pain important to you? What type of valuable activity does it prevent you from doing? Because let's be honest, why is pain a problem? That's a question I very often ask people. And pain is a problem when it impacts your quality of life. You can be in pain, but you can do any activity that you want to and not really care about it, and then it's not a problem. But the second it stops you from doing your valued activity, that's when it becomes a problem. So understanding your valued activity, understanding what's important to you, what drives you, who you are, what your values are, what you really want to do in life, and how this pain or this injury is preventing you from doing that, that is the first thing that a physio needs to establish. So you need to really be able to build that rapport with your patients.
Yep.
The next thing is a comprehensive diagnostic assessment. So if you have nerve pain, you need to have a full nerve assessment, which includes your sensation assessment, it includes your muscle power assessment, reflex assessments. You need to really dig into what is the underlying pathology of a problem to be able to provide some treatment, and then you should expect to get a treatment plan.
Yep.
So a treatment plan should explain to you what is your diagnosis, so what is happening. Can we actually figure out what is happening, or do we need somebody to help us with that? What is the prognosis of this? How long will this take to resolve? Can this resolve? Is this something you need to expect to live with and work around, or what is the prognosis of what we're doing, right? That's super important. Then they need to be able to tell you what can they do to help you, in what way can they be there to support you, and they need to let you know what can you do to help yourself. What are some of the principles of self-management that you can use to empower yourself to take control over this pain. Right?
100%.
And there needs to be transparency too. Like with DVA, very like this, not always a cost related, but there also needs to be transparency of cost because that's a big factor.
Yep.
Right. So effectively, non-judgmental listening, understanding you, taking an interest in you and in your life, and how this pain interacts with you, and why it's important for you to get rid of this pain is the biggest thing, actually.
No, that's That's great. You'd also definitely recommend, say, them having that holistic team around them. So obviously their GP, their pain specialist, they're all just kind of working hand in hand.
Yeah, 100%. If you meet somebody who contradicts the rest of your management team instead of working with them, you're probably having a bit of a red flag.
Yeah.
You want somebody who actively engages with the medical team, who talks to your GP, who talks to the other specialists involved, and who takes an active part in that without judging other people's profession. I think that's really important.
It is. Yeah, because part of the actual approach to recovery, you definitely do need that kind of active interest. You need that open communication. You need that health professional team also in the background, all supporting one another for the best recovery of that. Whether it be the veteran or the person themselves. The approach forward on it. So
100%. Yeah.
No, that's pretty straightforward. So great answer. Just moving on from that one. So That's what you can expect from your first visit to physio. Obviously, make sure that they all kind of work hand in hand. So if you've got your GP, you've got your pain specialists and stuff like that, with the physio, they're all communicating and looking after the actual veteran or the patient themselves. So excellent. Just moving on from that one, we had a veteran. So what they're doing is they're utilizing certain adaptations of gaming, like fitness gaming, though. So more
Mm.
or less the ring fitness. They're utilizing
Mm.
this for strengthening exercises, and I believe they mentioned cardio. What's your thoughts on these types of games, effectively? Not only on, say, the Switch and stuff like that that they're bringing out with these types of games, but even VR. So virtual reality in relations to, say, Beat Saber, where it actively involves movement and stuff like that. You know,
This is actually a very passionate area of mine. I love VR.
yeah.
I actually want to buy one for clinic. I'm trying to justify it for the boss.
Yeah,
um,
I could probably
VR is
get you in
actually,
contact with a psychiatrist that use them.
yeah, they're so good. They're
Yeah,
so good. They're amazing. Just to answer the specific of the question, the ring fitness was the part of the question. I'll address that first, and we can go into some of the other tools and stuff as well. So the ring fitness is effectively, for those who don't know, a circular device which has a controller on top and handles on the side, which you can use to press, squeeze, pull. That's kind of my understanding of the ring fitness device. My general go-to is gamify exercise. Do it. It's like, why not? Why wouldn't you, right?
yeah,
Why do the thing that you really, really love,
yep,
and it's getting you stronger, it's getting you fitter. Why not?
100%.
Yeah, and we need to understand that these type of devices will never replace things like, if you want to be a strong squatter, if you want to put a lot of weight in your back and squat down, they're not going to make you better at that, right? They're specific, but that's not everybody's goal either. It's like, it's just a general, how can I improve my activity while I game? Any gamification of exercise is excellent.
Yep,
It's fun, it's engaging, it's active, it takes a focus away from pain, which also reduces pain, which is really cool.
yep.
And yeah, it's just a much better way of engaging with exercise and rehab. So I love those type of things. I'm all for them.
That's great. Yeah,
Yeah,
And it's
VR
and
in particular. Sorry, Johnny, here you
I
go.
was just gonna say, and defining like exercise, like I find in this day and age with all the different franchise, I'm not going to mention names, but all the different franchised exercise platforms out there, um, y- everyone's addicted to the sweat angels. You know what I mean? Like they go in and they want to get flogged, they want to get worked to death essentially. And you don't have to start there. You know what I mean? Like I don't know where this came from, this mentality of you have to push it to the limit 100% all the time. There's nothing wrong with going for a walk or using these ring fitness apps or just counting steps. Like you're going to get amazing health benefits out of it anyway. So
yep,
yeah, if you're exercising, I would ask what is that exercise that you're currently doing, and get a proper assessment on it. Or there's plenty of ways to work around it. Hey, plenty of ways. So
yep.
yeah, yeah, we love it. We love all those kind of things.
Yeah.
Yeah, that's great.
There's a big difference in exercising for performance and exercising for longevity, a long and healthy life. Those things are different and they don't always mix together. So like if you want to be a very, very high performer in a sport, you're probably not going to live as long and you're probably going to have injuries.
Yeah,
So yeah.
Yeah, I can't remember the
In
stat on
saying
that, but I think
that,
it was like each
sorry,
year.
Donnie, I can hear you.
I can't remember the stat on that, but I think it was like each year that a professional athlete stays at their peak, they shave like 3 or 4 years
oh,
off
jeez.
their lifespan. Yeah, it's definitely not
Wow.
healthy, but yeah, there you go.
There you go.
It's pretty hectic. Um, I was gonna say when it comes to VR, VR is a particular area that I have a lot of interest in because I am a massive fan of anything neurally related. Like I love nerve conditions.
Yep.
VR gives you a very unique opportunity to trick the brain. So the brain changes, and we know that the brain changes. And it can be as simple as if you've had an injury, let's say a nerve injury in your left arm. I've done this with patients before. You can get patients to close their eyes and visualize the left hand, visualize the right hand. They can easily visualize a non-injured hand, but then they try to visualize the other hand and it doesn't exist because the map in the brain that represents that arm is gone. So without the visual input, you can't represent this arm in your brain. And that can be a big kind of factor that increases pain and increases disability for people who have sort of neurological disorders, but even just normal musculoskeletal pain. So VR actually allows you to build that new representation of an arm by allowing you to create a visual representation of an arm moving. So you're tricking the brain to believing that the arm is moving normally and that your body's moving normally through space. And that has been shown to restructure those areas of the brain that represents the body part. And you can start to then do that rehabilitation in a virtual environment. Like it's amazing.
So we do have a lot of veterans that do use the actual VR landscape for. Obviously, they suffer from other also mental health conditions and stuff like that, so they might be disinterested in certain physical exercises. However, this also provides a great kind of a fun factor for them while they're exercising. So it's kind of like we like to think of that first step also in a way. So it's creating obviously all those positive emotional balances for them. It's giving them fitness and stuff like that, which is great. But then also it might encourage them to go, hey, I'm going to go for a walk outside now because, you know, their mood's improved, you know, and other things like that. So there's a lot of great stuff that they're obviously doing in the VR space. I know even in the scape of, say, we've got like a psychiatrist that uses it, for example, with mental mindfulness and stuff like that. So there is a lot of great stuff coming forward in relation to it.
100%. It's love it. Absolutely love it. Great question.
Yeah, no, that's excellent. All right, thanks for that. Moving on, we did have a veteran. So this happens quite a lot. Obviously, as you move higher up in the ranks in defence, or you know, just as life gets busy and stuff like that, you get family and all the other stuff that goes on around you. They find it quite hard, however, though, to make time for themselves and other things like that. So, is there certain stretches, exercises? How would they implement these effectively into their daily schedule? It's kind of like one of those harder things they need to make time for themselves, but they're not. What would you recommend for them effectively?
If they're already engaged with a physio who's giving them too many exercises, they need to be very transparent and voice this to the physio. And there needs to be an incentive from this physio to work that around the lifestyle. A part of this is understanding the person, like we talked about earlier.
Yep.
So understanding who the person is, what they do, what is valuable to them is a really big step in achieving that, you say, adherence or ability to adhere to exercise. I always blame myself if I come back and somebody tells me I haven't been able to do my exercises often enough. That's on me because I haven't listened to their needs, their abilities, their time, right? So that's my fault, nobody else's. Unless they simply go like, I don't want to do the exercises, so screw this. But then again, I haven't listened to them and they don't like exercise and need to find another strategy, right? You don't always need exercise to get better. Certain things need exercise to get better, but very often it can be very simple little things that make a big difference. So an example to this is somebody with an Achilles tendon issue or Achilles tendonitis, right?
Yep.
Instead of doing a long calf this, every time you walk up and down the stairs, you pull the heel off the edge of the stairs. You're going to work the calves, but you're also not taking time out of the day, right?
Yep.
So little ways that we can work around these things. Let's say that somebody has an issue with, they need to strengthen the knee, but they don't really have time to strengthen. That can be as simple as when you're walking up and down stairs, when you're walking with that particular leg, just bend extra, like get down into the step, right? When you're walking up and down,
Yep.
or it can be as simple as standing up and down from the chair with one leg instead of standing up and down from the chair with two legs. So we can work around these things and we can implement little strategies in a day that make it better, but that communication needs to be had with the physio.
Yep.
If the physio is unwilling or to listen to you and hear that your day is actually too long and you can't fit this in, then make a point out of it. If you're still not willing to, then maybe you should consider seeking somebody who would listen to that because there are alternatives.
That's great feedback. That's great advice. There's nothing really you can add. They definitely, you're right. The physio should listen to them and make it work around the strategies and time that they have effectively. Obviously, that member should also be listening to the physio and implementing those certain strategies also. But yeah, would there be anything that you recommend? So, as I said, a lot of these veterans say, I know as they work higher up in the ranks as defence, they spend a lot more time behind a desk and stuff like that. While they're at the desk and things like that, obviously there's usually not a lot provided. I know in the veteran space and stuff like that, while they're at their desks and stuff like that. Is there any strategies that you'd recommend just for, say, exercises effectively to kind of help while they're at the desk, say?
So I like to have a band with me, so just a normal exercise band
Yep.
because they're very versatile. You can bring them with you. You can effectively have them in your pocket or around as a hula ring if you really game.
Yep.
You can never trust. But you can use that for everything. So let's say, for example, that I need to strengthen my back.
Yep.
All right, I have an exercise band. Let's see if I have one here to show you guys.
Yep.
Yeah. So as an example, if you need to strengthen your back, right? It's as simple as grab the band, put it on your feet, and when you have a little bit of time, just do a little bit of hip hinges like that to strengthen the back.
Okay.
That can be a good way to kind of get a bit of loading through. You have the tool with you, 15, 20 repetitions every now and then, right?
Great.
So strategies that I would do is I would get one of these bands. You can buy them for $6 at Kmart, or we can build them as consumables for you on the DVA.
Yep.
So you can do everything. You can do shoulder rehab here, right? You can do these type of exercises with them. You can even do curls for the girls,
Yep.
for the Ani others. So they're very versatile. So any exercise can be adapted to these bands, and you find these bands. Some of them are super heavy. Like some of them will weigh about 100 kilos and try to lift them up.
Yeah. Okay. Yep.
Yeah, that's the best kind of option I have. So versatile tools can be done anywhere. If you really need to do that at the desk, this is your best
That's
option.
great, yeah, because versatility is always a big one as people get more busy and stuff like that in life. The versatility of having something like that, I think, could definitely help a lot of the actual at desk workers and stuff like that. So I know a lot of our veterans are usually stuck at the desks for long periods of time, obviously with governance, paperwork, and as they get higher up, they kind of get pushed behind that desk more and more to just manage personnel and stuff like that too. So yeah, no, that's excellent. All right, moving on from that one. So there was a member who asked about equipment in the home space, and what could they buy that's easily to help with their strengthening for their different muscle groups and such. But they'll after there's something there with the same effect and something similar with the same effect, but without using any equipment bought. So, say body weight exercises while they're at home. You know, your general fitness maintenance and stuff like that while they're at home. What could they do both with equipment and both without?
Well, on the
So
equipment front, I think Andre would agree. You can't go past the kettlebell.
Yeah.
100%.
I actually got a kettlebell at home in my garage myself that I use quite regularly. So
yeah, great piece of equipment, really cost effective. You can do a million one things with it.
can.
So yeah.
100%. Completely agree. I would say first off that we need to have a couple of operational definitions here if we're going to be able to answer this question adequately, though, and that is first we need to define what are we trying to achieve with exercise. Are we trying to get strong? Are we trying to exercise for pain relief? Are we trying to just keep our bodies moving, right? So all of these things will change the answer to this question a little bit. For some people who don't necessarily want to get super strong, they just want to move, they want to have an able body, like your body weight exercises work fine. They work brilliantly, and there's tons of things you can do. And you can alter speed, you can alter range of movement, you can alter the amount of repetitions you do, you can alter frequencies. There's all these variables that we can play around with to make that challenging, to increase the resistance of it. And for those who have kids, like pop your kids on your shoulders and try to do squats, right? That's heavy. So kids are actually a versatile exercise tool. Let's just be.
Yeah. Get them to sit on your back at a few push-ups so you can feel the weight.
Exactly. So kids can be really fun for that purpose. But I think it's important that we have these operational definitions that strength in particular is your ability to lift as much weight or produce as much force as possible. And a lot of people say they want to train for strength. They actually don't want to train for strength. They want to train for a general level of fitness or ability. And it's important to operationalize this. So for those people who are not kind of super keen to get strong, they just want to be operational and fit. Kettlebell, body weight, bands, it doesn't really matter. We can adapt all of that. It's more to what is your preference, right? That's a big one there. I like the kettlebell similar to Jonathan. I'm biased in that sense because I love the history of kettlebell. I love that it's from Eastern Europe and the farmers used to have competitions with them. And it's a bit of a badass type thing, right? It makes me feel a bit more of a man because I know it's from Russia. So that's yeah. Yeah, I could say that 2 months ago. Can't say that now.
We'll edit that bit out now.
Edit it out. Like the purpose of it, just like it's a heavy belt. It feels good, right? It targets a grip, but you don't need that. But it depends. If you want to get super strong and your kind of goal is to get and like you want to lift a lot of weights, then you got to buy a lot of weights.
Yeah.
If that is not the point, then anything else works. It's up to you and it's up to your preference, and we can make it effective regardless.
Yeah, no, that's great.
Even just a skipping rope. Like a skipping rope is such an underutilized
Yep.
piece of equipment for cardiovascular health. Like
Mm.
cheap as chips.
Yeah, yeah, they're like $5 or something down Kmart from what
Yeah.
I've seen. So you're right. Like the kettlebell's quite often used for a lot of. I know coming from the army side, quite a lot of veterans use that in the army side and stuff like that. I'm pretty certain it's used across the whole board and stuff like that. So I don't think you can really go past that kettlebell, like you said. The skipping pro, obviously, for cardio stuff. If they got a swimming pool and stuff like that, probably a mindfulness, but also a physical activity too. But yeah, no, that's some great exercise, I think, for them while they're at home and stuff like that. Would you notice that there'd be any large difference, say, obviously, if they were to buy, say, a dumbbell or a kettlebell and stuff like that, and they were to do, say, squats or, you know, certain different types of push-ups with that kettlebell in a way, would that build further general strength for that member rather than their own body weight?
Yeah, so this is where we need to operationalize strength.
Yep.
Strength is the ability to produce as much force as possible. And when you add an external load and you make things heavier, you require to push more force in order to produce that adaptation.
Yep.
So if you want to become strong, yes, but that's a lot of people don't really understand what strength is. That's the problem.
They want general fitness
If you,
mainly.
yeah, exactly. So if you want to get strong, heavier weight is better.
Yep.
Yeah.
And it's also super relative, right? Like you you could get a 10 kilo kettlebell for person A, and that person can lift that kettlebell 20 times, and then person B they can only lift it once or twice. Person B's you're 100% training strength because you're in that 1 to 5 rep range, whereas person A's developing more like muscular endurance than strength per se. So yeah, you got to get quite specific with that. Yeah, just a bit of a caveat to that answer as well.
No,
Yeah.
yeah, no, that's great feedback and great advice in relation to the actual equipment at home, but also the actual body weight, what they can do and stuff like that. So, obviously, leading in that, obviously, a lot of our veterans will enjoy either a game on the couch, VR, or on the PC. Um, is there any quick kind of like 2-3 minute exercises? I know that kind of falls hand in hand with the stretches and movements with the posture and stuff like that also. But this one was specifically targeted at the PC that they can do while they're on the PC to ensure that their wrists aren't getting sore. So they might not already be sore and stuff like that, but just over a longer session, it might be getting
Yeah.
sore and then settles down. I think that's possibly the posture. Yep, that's all.
Yep, that's all.
Okay.
That's number one.
Yep.
So very often soreness in relation to wrist when you're gaming is a TOCC injury in the majority of cases. If the compression tape like this doesn't help or this here doesn't help, it's likely another issue and that needs to be looked at specifically.
Okay. That's fair enough. And you can buy those pretty much in most health stores online or physios.
Yeah, you can buy the wrist fitted online, but
Yep.
to be honest, if you're linked in with a professional, like with a physio, get them to order it in as a consumable.
Yep. No, that's great advice. That's great advice.
I mean, this advice isn't specific to wrist health per se, but I was actually looking at a bit of a study coming into this, and for gaming performance, there is some stuff you can do leading into your gaming bout that research has shown can improve cognitive ability, your accuracy, like in game, and that's about 10 to 15 minutes of moderate to high intensity exercise
Yep.
of anything of your choice. So if you do that leading into the game, your performance in game will increase. So not specific to the wrist, but probably quite relevant to a lot of your audience.
Yeah,
So
no,
Yeah.
100%.
yeah.
Especially for the esport audience and stuff like that are quite on the competitive scenes. 100%. One of the other ones was I was reading. I don't know. You might have some further feedback on this, but specifically for the PC use and stuff like that and the mouse, they recommended that certain amount of bicep curls, not bicep curls, wrist curls, could actually help with a lighter weight before that. Is this something that you see could possibly help in an esports scene, or just strengthening that wrist in a way to kind of prevent those injuries almost?
Yeah, so it won't necessarily prevent the injuries and it won't necessarily impact pain, but performance is a different, like, we need to separate those two.
Yep.
Yeah. Pain and injury, it can't always be fixed by exercise, right? Particularly in a weight bearing joint. This is why things like, when you have a person with severe hip arthritis, we actually recommend surgery rather than exercise because it's more effective.
Yep.
Right, and that's why also things like your carpal tunnel syndromes, we recommend surgery if they're pretty severe because exercise doesn't really do that well for that type of injury. So we need to pick our injuries for exercise. Now, in terms of responsiveness of the wrist, so the ability to be quick and move the wrist quickly, the stronger we are and the more powerful we are, the faster we can move. Right, so there's no harm in building strength, and the stronger your wrist is, the quicker you'll be able to accelerate.
Yeah, no, that's great. Like, yeah, because anything to strengthen the wrist is a big one, especially in the esports scene. Obviously, that's the performance side leading into, you know what I mean? It's a bit different there too. So, no, that's great. This led into, so one of our veterans, and this will be the last question that the veterans have asked us. They were asking about certain different breathing and cardio exercises, and does physio actually implement any of these breathing or certain cardio exercises to control breathing, specifically around?
I actually did my bachelor thesis on cardiac physio, which is pretty interesting. So, or respiratory physio, we do. So I do breathing assessments all the time with people. So things that we look at in breathing, so we can auscultate. So I have a stethoscope. I can auscultate. I can listen to your breath sounds, listen to if you have phlegm in your lungs and that kind of stuff too for your breathing. But I also look at the way that your thoracic wall functions. So look at how the ribs expand. I look at how the symmetry of rib expansion. I look at the mobility of your ribs. I look at different types of diaphragmatic breathing versus apical breathing patterns and stuff like that to help you with different things. It depends on what the problem is. So the short answer is yes. Cardio exercises, a physio who has a bit of experience in strength and conditioning can definitely help with cardio exercises because that's for cardiovascular fitness and health. But this is also where we have excellent exercise physiologists who have a lot more knowledge and experience in that field than we do.
And just to build onto that, I think for your audience, just to differentiate between the two, I know exercise physiology is quite new, and a lot of people will ask for exercise physio, thinking they're getting a physiotherapist. So I mean, generically, if I just talk generic terms, not the physios at Exercise Champion Health, because they're and like, to be honest, not to toot our own horn, but we are very lucky in a sense that a lot of our physios do have strength and conditioning backgrounds. So they are by all means not your generic physio. If you go to a generic physio, chances are, you'll get your breathing exercises, but I doubt it that they're going to get you down on a rec bike, or doing some boxing or something like that to get your heart pumping. So yeah, definitely. If you want the cardio development, probably an exercise physiologist for that area. Yeah. But not at Champion Health.
No, that's great. And I'll throw just one last one in there on a personal one. We've obviously had some throughout the chat previously that we've already answered and stuff like that. Just this one personal. So obviously you'll see your sports professionals and things like that. If you're aiming to be for recovery and stuff like that, what are your thoughts on, say, ice tanks and other things like that around this concept of it?
Well, yeah, we did when I was at uni, we actually looked deep into this because obviously I did my training at, well, not obviously, I did my training at James Cook University, which is in Townsville, which is the same uni that Andre studied at, and we did a lot of work with the Cowboys, and they were implementing a lot of ice baths, and one of the our lecturers there was doing a PhD on the topic. So we looked at all the evidence that they collected. Now, from a physiological level, controversial topic, it doesn't actually do anything. Now, from a feel good perspective, it does. So, inflammation markers, it didn't do a great deal of, but it did make the player It could dull nerve ending sensations,
Yeah.
so you have a less of a feeling of delayed onset of muscle soreness, sometimes called DOMS.
Yep.
But it's a real personal thing.
Okay.
That's basically what the study concluded. It was like some players like to do it and they feel better after it. But can we sit back here and say that from a physiological standpoint that it's amazing? It's the bee's knees. We can't. It's yeah.
Let me kind of further a little bit because Johnson is absolutely right. All the evidence points to it's actually not effective. There are two things to keep in the back of your mind here, and that is that if you have a heart condition or any vascular condition, you should not be doing ice baths because that can lead to cardiac arrest. It shocks your system, so you've got to be very careful from that point of view. Now, the other part of this is you can't ignore the feeling better factor that comes from it, and this is probably where performance is going to increase if you do it straight before a game. Jump in an ice bath, you're going to come out and you're going to be like, fuck yeah, I'm going to go get this, right? You're going to be pretty amped up. That's different, right? That happens to a lot of people because, it's a bit broad to jump in an ice bath, and that's cool. But from a recovery point of view, it does nothing, and it can lead to a heart attack, so be careful. In terms of recovery, in order to be as fit and healthy as possible for these type of games and to be as focused, it comes back to very simple things: good quality sleep, good quality nutrition, all right, and general exercise. They are the three biggest things when it comes to recovery in all the evidence there. You need your 8 hours of sleep if you can. Avoid the energy drinks. Like a cup of coffee is fine, but the energy drinks, they actually reduce your performance quite significantly over time. So good quality nutrition, good quality food, like super important. Sleep is super important, and your general exercise is going to get you in peak performance.
Yeah, no, 100%. I've always been a firm believer in relations to, say, a banana, say, will give you the same amount of energy and performance as an energy drink, say. You know what I mean? The energy drink will have that kickback, where it's only like a quick fix almost, and it has a very quick drop off.
100%.
Yeah. No, that's excellent advice. Yeah, well, that was all the questions that our veterans have asked today. So we really appreciate the time. Obviously, the questions that were asked were out there. There's some good questions asked throughout the actual discussion also. We see a few just popping up here. Obviously, Aaron Cheney obviously popping up in relations to the ice bath, saying it can cause obviously that vasovagal syncope.
Definitely can, which is fainting. For people who don't know that, it can cause a drop in blood pressure that causes fainting. That's vasovagal syncope.
And that's pretty sweet. So, we definitely appreciate both your times today. For those who don't know, obviously they've gone through the spiel of what Champion Health's about and stuff like that and who they are. So they're doing lots of great work in relation to the veteran landscape. You will see on our Discord, on the VGA Discord, quite a lot of information posted up in relation to the veteran news section. So when they're coming up with, say, not only physio related activities, they also have a social wellbeing event where they meet up at certain gatherings for veterans and stuff like that, which is really good. No other physio kind of really does that, so it's really good. So they're doing a lot of good work in the veteran landscape effectively though. So and if you've got any questions, we will have the details for Champion Health, both the email and these guys' emails and contacts. So if you do have any kind of later questions, just field them through to these guys and they'll be able to help out in that effectively. So, but on that note, I really appreciate both of your times and dropping by and giving us, all that handy information. And we look forward to playing more to come. So,
thank you, Sam. It's been an absolute pleasure, mate. Thanks for having us on.
Thanks for the opportunity. This was great. Love it.
Legend, boys. All right, you enjoy the rest of the night. Thanks, boys.
You too.
See you later.